Hi everyone, it's Kim here. Look, today I was asked to speak about things like reflux, colic, and generally an unsettled baby. So I'll cover those things now. As a child health nurse, we see lots of parents who come in and they're concerned because the baby's really unsettled and seems to be uncomfortable or in pain. And this could be because when the babies are born, their gut's really immature and it takes time for this to settle down. So we often see new babies who have an unsettled period of 2 to 3 hours in a day, and this type of unsettled scenario usually peaks at about week 8 to 9 and then starts to go by week 11 to 12 as the baby's gut matures. So in saying this, there could be other causes or reasons why the baby's unsettled. You know, one of the most common reasons is that the baby's overtired, the baby could be hungry or overfed. So if you haven't watched the videos on tired signs and responsive settling, then maybe go back to those because a lot of your questions could be answered in those videos. Okay, so while reflux can lead to babies being extremely unsettled, true reflux is actually very rare. And some of the medications that are used for reflux can be harmful. I know there are cases where there's extreme reflux and they're necessary, but that's for you to decide in consultation with your GP and your doctor or your paediatrician. Okay, so if you've been to see your child health nurse, the GP or the paediatrician, they've gone through feeding and sleep and other potential causes of an unsettled baby, but you're still concerned, please go back and see them again or find another health practitioner. So keep in mind that positing, that's when a baby just brings up a small amount of fluid or milk, is completely normal. When babies are born, they have quite a small stomach and there's a little lax sphincter that joins the esophagus to the stomach, and then the esophagus is quite short because they're just little people. So it's quite easy for fluid just to come back up and out of the mouth, and that's called regurgitation. Okay? So there are a group of babies who vomit large amounts and much more frequently, but they're still thriving. So they're actually called happy chuckers sometimes. And if they're still thriving, we wouldn't actually do anything about that. But also, always, if you're concerned, you go back to your health professional of your choice. Okay? So if Bub's having 5 or 6 heavy wet nappies a day and soft yellow poos if they're breastfed and soft poos that can vary in colour if they're bottle fed, and they're gaining the amount of recommended weight for healthy growth and development, then the baby's getting what they need to thrive. Okay? So things you can do to minimise reflux are things like feeding your baby in an upright position, and holding your baby for 20 or 30 minutes after the feed. Gravity can just help the milk or contents of the stomach to stay where it's meant to be. Just avoid jiggling the baby while they're after a feed. So try smaller, more frequent feeds. Just a smaller amount in the stomach can help the baby just to keep the food down. So take time to burp the baby frequently because then the baby can bring up more of the wind, whereas if it's in the stomach and the baby feels full, then they're more likely to have reflux or bring more of the food up. So that information comes from the Mayo Clinic. So I've put the link in there, so if you want to look into it a bit more, you can. Okay, so common remedies for colic and reflux or gut discomfort are things like wind drops or colic relief drops. You can get these from the pharmacy, your naturopath or your homeopath. So just talk to those professionals and ask them for information before you choose what you'd like to use. Hot packs aren't recommended just because of the risk of burns to the baby and overheating. So this topic, as I said, was requested by parents in this group. So if you've got a topic that you'd like me to cover, I'm more than happy to do that. Just I'll ask each week what we want covered, but if you want to tell me in between times, you can either put that on the page or PM me, whatever you like. Always remember that I am available for one-on-one talks or consultations if you'd like that, and that we do have another group where we have live calls twice a week. If you'd like to join that at any time, just reach out for information. So have the most beautiful week. I hope this helps in some way, and I look forward to seeing you soon. Bye.